So welcome to our first tutorials on 2015 booklet. So we are having a 13 months after the first labor, a 24-year-old patient complained of amenorrhea. Again, amenorrhea simply means absence of what? Menses or menstruation. Pregnancy ended in CS because of premature detachment of normally positioned placenta. That should tell you that we are having a case of, she had a case of what? Placenta abruptio, isn't it? Which resulted in loss of blood at the rate of 2,000 mils due to disturbance of blood clotting. Again, this is postpartum what? Hemorrhage, isn't it? And again, we had a case of premature detachment of a normally positioned placenta. Now, the question now is choose the most suitable investigation. Choose the most suitable investigation. Now, with all the history that I've been given, this woman is having no menses after 13 months. No menses after 13 months, if I'm correct. No menses after 13 months. So usually what you have to do is, since there's no menses, you have to check for what? The presence of pregnancy. You have to check for the presence of pregnancy, because a woman in her reproductive age with amenorrhea, it could be a sign of pregnancy. And of course, to confirm that, you need to do the beta HCG or gonadotropin rate. You need to check the gonadotropin rate, the same as beta HCG. HCG. All right, so over here, you want to estimate the gonadotropin rate. So your answer should be what? C. Oh, where is it? All right, so the answer is C. So we have a 24-year-old primipara who was hospitalized with complaints of discharge of amniotic waters. So kind of first time the woman is getting pregnant, kind of a thing. Down there's what? Discharge of amniotic waters. And usually it's when you are in labor, then perhaps this water could come out, isn't it? But over here, let's look at it. There's a discharge of amniotic waters. The uterus is tonic on palpation. The position of the fetus is longitudinal, which normally is the normal baby lie, isn't it? Now, it is pressed with the head to the pelvic outlet. Again, it tells you that the baby's head is kind of engaged. Now, palpation of the fetus is rhythmical, 140 beats per minute, auscultated on the left below the navel. On internal examination, the cervix of the uterus is 2.5 centimeters long, dense, and external opening is closed. Ladies and gentlemen, external opening is closed. Opening is closed. That means it's not supposed to allow anything to come out because it is closed. Now, light amniotic waters were or are discharged. Point out the correct component of the diagnosis. So again, since there's no cervical opening because of they saying that the external opening is closed, it means that there is no cervical opening. And of course, there's no contraction because they've mentioned nothing like that over here. So that means that obviously labor is absent. So when you have labor to be absent and we are having amniotic fluid coming out, of course, it is an indication of what? Early discharge of amniotic fluid. And I think we discussed this extensively in one of the obs and gynae bases. We discussed it extensively in one of them. So please do well to go through it again. We talk about the different types of amniotic releases. Some occurring before labor, some occurring right at the beginning of labor, and some occurring even in the middle of labor. We discuss all of them. So please take your time and then go through the obs and gynae tutorial that we did in one of our bases. So over here, we're looking at what? We're looking at, where are these things not coming in? So we're looking at what? Antenatal discharge of amniotic waters. Antenatal discharge of amniotic waters. More or less, there's an what? So now don't confuse. Good. I've seen a confusion over here. Don't confuse antenatal discharge from early discharge. Don't confuse the two. In antenatal discharge, it's more or less like the woman is not yet in labor. In early, just at the beginning of the labor or contraction, discharge comes. So please don't confuse the two terms over there. So here we're having what? Antenatal discharge, because there's no labor insertion. All right. A patient was delivered to a surgical department after a road traffic accident. Again, anytime we talk about road traffic accident, what comes to mind? Most of the time, what comes to mind is what? Pneumothorax. We know this already. Most of the time, we think of pneumothorax. But let's see if it has to do with something like that. So, road traffic accident with a closed trauma of the chest and right-sided rib fracture. So, there's a rib fracture. There is what? A closed trauma on the chest. The patient was diagnosed with right-sided pneumothorax. You see? Now, it is indicated to perform a drainage of the pleural cavity. Of course, the treatment for pneumothorax is to drain it. So you have to do what? A puncture. But the question is, where should the puncture be made? Where should the puncture be made? Where should the puncture be made? And usually we do it at the second intercostal space in the mid-clavicular line. Second intercostal space in the mid-clavicular line. That is where we do this pleural puncture. So your answer should be what? Oh, today this. The answer should be B. It should be B. So I don't know why this thing is wasting time like that. All right. A prima gravida was with pregnancy of 37 to 38 weeks, complained of headache, nausea, pain in the epigastrium. I already know what some of you are thinking. And of course, you are absolutely right. Preeclampsia. Objectively, the skin is acyanotic. Face is hydropic. Short fibrillar twitching of the blepharones, muscles of the face and interior extremities. Stared is fixed. BP 200, 110. Sphygmos is of 92 beats per minute. Intense respiration rate is 32. That means it's also in dyspnea as well. Heart activity is rhythmical. Appreciative edemas of the inferior extremities are present. Urine is cloudy. What medication should be administered? What medication should be given? Ladies and gentlemen, over here, we are thinking of a case of what? Preeclampsia, of course, with severe features. Preeclampsia with severe features. So we can think of what? Severe preeclampsia. And if care is not taken, it will easily lead to, eclampsia. And usually, the drug of choice we give for people that are at risk of entering or developing eclampsia. When we say eclampsia, it's simply preeclampsia plus seizures. So one of the medications we give to prevent the seizure from happening is magnesium sulfate. Magnesium sulfate. And again, to treat the BP, you give what? Hydralazine or labetalol. And usually, droperidolum is actually contraindicated. It is contraindicated. But Krok says this is droperidolum. and I discussed this one the last time, that this drug is actually contraindicated. Your right answer should have been what? Magnesium sulfate. And even that is not even in our option. So, for the sake of Krok, of course, we can go in for our droperidolum. But in the field of medicine, or when you are practicing, please be careful of that drug. All right. Hey, today we're in trouble. A patient with high temperature came to a first aid post in the evening. The fact of temporary disability was established. Indicate the measure to be taken in this case. Indicate the measure to be taken in this case. So first of all, the person came with high temperature for first aid in the evening. In the evening. And you know, in the evening, of course, we have what? Night doctors, or those who are on duty at night. Isn't it? Those who are on duty at night. So over here, definitely want to issue what? A certificate that this person is temporarily disabled, because they say that it has been established. Temporary disability has been established. And you know that when things like this happen, you have to give or we have to issue a certificate to show that indeed the person came and is rendered or was diagnosed with the fact that he cannot be able to do some things, isn't it? So that's what we have to do. So therefore, what or who is supposed to do this? Definitely the ninth doctor or the ninth person who was on duty should be able to issue this medical certificate, which will be eventually be used to give the person days off from work or sick leave. Ukraine, they call it sick list. But it's supposed to be what? Sick leave. More or less like saying the person should be given an excuse duty. In Ghana, we call it excuse duty. Okay. So the person should be given an excuse duty for the fact that he or she is temporarily disabled. So your answer should be what? Should be E. Should be E. All right. A 10-year-old boy complains of pain in his left eye and strong photophobia after he has injured his left eye with a pencil at school. Left eye examination revealed blepharospasm, ciliary and conjunctival congestion. Cornea is transparent. Other part of the eyeball have no changes. Visual acuity is 0.9. Right eye is healthy. Its visual acuity is 1. What additional method would you choose first of all? What additional thing will you choose first of all? Don't forget, this person has choked his eye with a pencil. So what you have to do is that you want to check in the eye. Perhaps there's a foreign body inside the eye, isn't it? You want to check inside the eye if there is a foreign body inside, or there is some scrapings from the pencil left inside the eye. You want to check. And the method that you have to use to check is the fluorescent eye staining. The fluorescent eye staining. Because this is the test that is used to detect foreign bodies in the eye. To determine foreign bodies in the eye. So over here, definitely you're going to do what? A staining test. You do a staining test. A staining test. Staining test. So your answer here should be A. Staining test. All right. So if you are enjoying this, remember to subscribe to this channel so that you don't miss any video that we post over here. Okay. An infant was born with body mass of 3 kg and a body length of 50. Now he's 3 years. His brother is 7 years old, suffers from rheumatic fever. Mother asks a doctor for a cardiac checkup of the 3-year-old child. What is the left relative heart border? Sorry, where? Where is the left relative heart border located? Left relative heart border located. So usually it is located on the left. It is located 1 centimeter from the left mid clavicular line. Again, 1 centimeter, on the left side, 1 centimeter mid clavicular line. 1 centimeter mid clavicular line on the left, on the left, on the left, on the left. So over here, we're looking at what? We're looking at A. 1 centimeter left from the left mid clavicular line. Mid clavicular line. That is where we can locate the left relative heart border. All right. Yeah. What are some of the options? Today, wow. Okay. A body was born at 36 weeks of gestation. Delivery was normal by natural way, that is vaginally. The baby has a large cephalohematoma. That means the head is quite big, like Nene. The results of the blood count are hemoglobin is 120, which is actually okay. ER is 3.5, that is erythrocyte, 3.5 times 10, blah, 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 blah. Bilirubin level is 123, that is quite high. Direct is 11, and indirect is 112. Now, we have done jaundice before, if I'm correct. And we'll talk about what the different types of what jaundice. We'll talk about the pre-hepatic jaundice, the hepatic jaundice, and in the post-hepatic jaundice or obstructive jaundice. And we said in the pre-hepatic jaundice, usually we are having too high level of what indirect or unconjugated bilirubin. We established it, isn't it? Then in hepatic, we can have perhaps equal amount, but of course, there should be high level of what? Indirect. And then in post, definitely there will be high level of direct bilirubin or conjugated bilirubin. Now, one of the major causes of prehepatic jaundice is what? Hemolysis or erythrocyte destruction. Erythrocyte destruction. Erythrocyte destruction. And that's what over here, for us to have, so over here, we're definitely having what? A pre-hepatic kind of what? Jaundice. And that is as a result of what? Erythrocyte hemolysis. Erythrocyte hemolysis. Erythrocyte hemolysis. And that can also be because of what? There is bleeding. You see over here, there's cephalohematoma. That is bleeding inside the what? The head. Bleeding inside the what? The head. Cephalohematoma. Bleeding inside the head or underneath the, the bone. Wait, did I just mention a big head here? Please. It's bleeding inside the head. Bleeding inside the head. All right. All right. So the answer here is A. A patient has been hospitalized. The onset of the disease was gradual. Nausea, vomiting, dark urine, alcoholic stool, yellowish of the skin, and sclerus. Again, we are having what? Another type of what? Jaundice. Another type of what? Jaundice. And anytime they mention dark urine and non-color of the stool, that is alcoholic stool. Alcoholic stool. What comes to mind is what? Could be a problem with what? With the liver. Or simply put, there's what? Too much of what? Bilirubin out there. Just that they are not, how do you call it? How do I put this one? But more or less, we are having what? Conjugated, if I'm correct. Okay. More of what? Conjugated. Now, the liver, now look at the clue here. Look at the clue here. They said the liver is enlarged. So again, there could be a problem inside the liver. Jaundice developed 14 days after the disease. Liver is now diminished in size. What complication of viral hepatitis? So again, they've given you the answer. What complication of viral hepatitis has taken place in this patient or is causing the complication here? What complication? What complication has developed? And of course, we are having a problem of what? Hepatic encephalopathy. Hepatic encephalopathy. Yes, although we are supposed to see, how do you call it? More of neurological what symptoms present. But don't forget, nausea and vomiting are controlled by the central nervous system. They are controlled by the central nervous system. So I thought that they've not mentioned confusion in the patient or things like that. Doesn't mean that it is not having a problem in the brain. Definitely it is having a problem in the brain. So over here, we are thinking of what? Hepatic encephalopathy. Hepatic encephalopathy. Hepatic encephalopathy. So your answer here should be what? Should be C. Sorry. D. D. An 18-year-old patient was admitted to the hospital with a complaint of headache, weakness, high fever, sore throat. Objectively, there's an enlargement of the group of lymph nodes, were revealed. The liver is enlarged by 3 centimeters, spleen by 1 centimeters, leukocytosis are present. Guys, look, atypical lymphocytes are present. Now, atypical simply means it is non-typical. What we mean is that there could be the presence of unwarranted growth. Okay, unwarranted growth. It's not the normal cells that grow. It's becoming what? Proliferative. It's becoming what? Proliferative. Okay, so we have what? Atypical. When we say atypical cell, we're referring to what? Tumor. Just to draw your mind to what I'm talking about. And they are saying it's what? 15%. Now, what is the most probable diagnosis? What is the most probable diagnosis? So again, over here, what are we looking at? We are looking at a case of mononucleosis. We are looking at a case of mononucleosis. Mononucleosis. And I'll tell you why. So first of all, we are having what? A case of sore throat, okay? A case of sore throat, high fever, and we are having lymph node enlargement. Yes, I know you might be thinking of, let's say, how do you call it? A problem with the lymphoid system, which of course you are not far from right, okay? Problem with the lymphoid system, you may be thinking of a tumor or acute leukemia by the lymphoid origin. You are not far from wrong. From right, anyways. You are not far from right. Okay. But looking at the case that we are having over here, with the presence of liver enlargement and spleen enlargement, we can be looking at a case of infectious mononucleosis. Don't forget too that in leukemias, yes, there could be temperature, but it will not be very high. There could be temperature. Temperature can usually be what? Subfebrile or, normal temperature. But for us to have a very high temperature, this is a case of what? Infectious mononucleosis. And again, this is usually caused by EBV virus or Epstein-Barr virus. Epstein-Barr virus. And usually it's very, very common in teenagers. It is very, very common in teenagers. But of course, it can affect every other age group. Okay. So basically, that is what we are, looking at. And usually, this disease normally causes the fever, the sore throat, the enlargement of the lymph node, tiredness, and whatever thing that we are even seeing over here. And sometimes it can lead to spleen rupture. Sometimes it can lead to spleen rupture. So over here, we are looking at a case of what? Infectious mononucleosis. Infectious mononucleosis. So the answer should be C. Should be C. All right. A 60-year-old woman, mother of 6 children, developed a sudden onset of upper abdominal pain that is radiating to the back. It is radiating to the back, accompanied by nausea, vomiting, fever, and chills. So definitely inflammation could be present, right? Now, subsequently, she noticed a yellow discoloration of her sclera and her skin. Guys, before I continue, take note of the fact we're having what? Upper abdominal pain. Upper abdominal pain. Now, on physical examination, the patient was found to be febrile with temperature of 38.9. Along, guys, so this one are giving you your answer. They said the problem is occurring at the right upper quadrant tenderness. So what comes to your mind is either the liver or the gallbladder. The liver or the gallbladder. But if you look at the case we are having here, there's not really much to be talked about concerning liver. But what we can talk about is, of course, we are having a case of what? Gallbladder. A case of what? Gallbladder. And over here, the appropriate answer will be what? Stones in the gallbladder. That's cholelithiasis. Cholelithiasis. So your answer should be D. Your answer should be D. Of course, it can also lead to what? Inflammation. It can lead to inflammation. All right. So we have what jaundice, what juice is recommended to be included in a complex drug and diet therapy for patients suffering from gastric or duodenal ulcer with high acidity of gastric juice to speed up the ulcer healing. We talked about this the last time, that, of course, your answer is supposed to be what? Potatoes. And why? Because these food substances contain what? They contain vitamin A. Potatoes and carrots, they contain vitamin A. And vitamin A serves as a protective effect against development of ulcers. It serves as a protective effect against ulcers. And that is why over here, we have to go in for what? Carrot and potatoes. Carrot and potato. And I know Ukraine there, potatoes is the cheapest food that you can think of. So please, keep eating potatoes, especially those who have ulcers. Keep eating potatoes. It will do you a great good. To do you a great good. So over here, your answer should be B, potatoes and carrot. Potatoes and carrots. All right. We have discussed this question before, so please. A 40-year-old woman has been hospitalized for attacks of asphyxia. Okay. Cough with flames. She has a 4-year history of the disease. The first attack of asphyxia occurred during her stay in the countryside, in the village. Further attacks occurred while cleaning the room. Again, this should be drawing your attention to the fact that what disease will ensue when you are faced with perhaps substances that you don't like or dust or things like that. Of course, you are thinking of what? Of asthma. You are thinking of what? Asthma. So definitely this patient is suffering from what? Asthma. So again, they said after 3 days of inpatient treatment, the patient condition has significantly improved. That's because the person is not facing those harmful substances coming as a result of cleaning the room or from the countryside. So what is the most likely etiological factor? Of course, what substances causes, causes asthma? In fact, in this case, where we're having cleaning in the house. So definitely you are thinking of what? Household allergens. And allergens are simply factors or substances that causes allergic reaction. As simple as that. So over here, we are looking at the case of what? Household allergens. Household allergens. So your answer should be E. I love this question because we know it's like crazy. Now, a 13-year-old girl complains of periodic prickling pain in the heart region. Percussion revealed no changes of cardiac borders. No changes of cardiac borders. Auscultation revealed arrhythmia, enhanced heart sounds, extrasystole of 20 to 25 cardiac pulse. ECG shows sinus rhythm, impaired repolarization, that means resting. Single supraventricular extrasystoles are present at rest. What is the likely diagnosis? What is the likely diagnosis? Yes, so over here, or even though, you see, basically, we discussed it before, and we are saying that having signs and symptoms of heart pathology without an obvious cause, we call it what? We call it effort syndrome, also known as somatoform autonomic dysfunction, also known as neurocirculatory asthenia. We talk about all of these things. So over here, we are having what? Signs and symptoms of heart problems, but with no obvious what cause. This is just a 13-year-old boy. So you can't tell me that this person is suffering from myocardial infarction. No. Come on. 13-year-old girl. You can't be thinking of MI. You can't be thinking of MI. Isn't it? You can't be thinking of MI. So over here, we are looking at a case of what? Somatoform. Somatoform. And we've dealt with this severally. We have seen different questions operated in different ways. And we're still waiting for what? Somatoform dysfunction or autonomic dysfunction. So you are here. Your answer should be what? Should be A. Somatoform. Somatoform. All right. A 24-year-old patient visited a doctor complaining of enlargement of his submaxillary lymph node. Guys, just a second. Let me pause this. All right. So, enlargement of his submaxillary lymph node. Now, objectively, all these lymph nodes are enlarged. Submaxillary, axillary, inguinal. They are all what? Enlarged. Chest X-ray shows enlarged lymph nodes. Erythrocyte is 3.4. Color index is 0.8, which is kind of okay. Platelet is okay. Leukocyte is quite okay. Eosinophils, band neutrophils, segmented neutrophils. Lymphocyte, ESR. What test must be prescribed to verify the cause of what? Lymphadenopathy. You see, lymphadenopathy. So, we have a case of what? Lymphadenopathy. And lymphadenopathy simply means what? Disease of the lymph nodes. Disease of the lymph nodes. And if you want to verify the disease, what do? You do a biopsy. Do a biopsy. Do a biopsy. So you do an open biopsy. Do an open biopsy. Open biopsy. So here, your answer should be what? Should be open biopsy. Open biopsy. So your answer here should be what? Should be C. Should be C. Don't just use a needle to aspirate to check. No. Do an open and take, quite amount of the tissue and check it out. Okay. Because just using a needle or a puncture to just aspirate small might not give you exactly what you're looking for. Okay. That's what you must do an open biopsy of the lymph nodes. Open biopsy. All right. A 60-year-old woman has been suffering from arterial hypertension for 15 good years. So HPT, 15 years. After recurrent stroke, obviously one of the complications of hypertension is what? Stroke. Still complaining of unmotivated bad mood, problems with attention concentration. She forgets to close the entrance door, cannot recall events of the past. CT scan shows post-infarction changes in the cortical postfrontal areas. Again, when we talk about Post-infarction. Infarction simply means what? Necrosis, isn't it? Necrosis, inadequate blood supply, ischemia. That's what they all mean, isn't it? Now, because of ischemia in the brain, which of course led to the development of the stroke, we are having all of these symptoms. So, what is your diagnosis over here? Definitely, we are having a case of what? Dementia, forgetfulness, isn't it? But this is of a vascular origin. So we have what? A vascular dementia. Vascular dementia. Why? Because there is inadequate supply of blood to the tissues of the brain. Hence, post-infarction. Post-infarction. So here, your answer is B. All right. Clinic of a Research Institute for Occupational Disease examined a worker who works at a concentration plant and diagnosed him with a chronic dust bronchitis. Okay. The case is investigated by the commission, including the representative of the plant, medical unit, territorial sanitation center, displacement, department of social insurance, blah, 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 blah. The question is, which one of these can head or should be headed? Which one of these should be the head of all of these commissions? Which one of them? And we'll talk about this, that usually the territorial sanitation center is the head of all the committee, is the head of the committee according to the Ukraine. The Ukraine. Usually the right term is Territorial State Emergency Service. Territorial State Emergency Service of Ukraine. But they also call it what? Territorial Sanitation Center. Territorial Sanitation Center. It's the same thing. So over here, your answer should what? Should be A. Should be A. So we have a 4 days after a patient received a gunshot wound of the middle third of the thigh. Soft tissues in his condition suddenly began deteriorating. These are complaints of bursting pain in the wound. Pain increases during the last 12 hours. Edema of the skin, hypodermic tissue quickly grows. Temperature 38, heart rate is this. The wound edges, gape, are dull in color. Muscles viable as of day before. No, now protrude into the wound. Look boiled, dull in color. Very dirty gray coating. That to tell you that there is what? Gangrene formation or necrosis already forming. Gangrene is forming already. Gangrene is forming. To be specific, we're talking about a gas gangrene. A gas gangrene is forming in this patient. A gas gangrene is forming in this patient. Now, what infection has developed? Of course, we're having a case of what? A gangrene, but of course, one of the major things that causes gangrene is what? It's Clostridium, isn't it? Clostridium. And to talk about Clostridium, then we are definitely talking about anaerobic bacteria. Anaerobic bacteria. So that is the infection. But to specific, we're talking about what? Clostridium perfringens or Clostridium. And Clostridium is anaerobic as well. So your answer is C. Again, you've done this before. Bacteria is an analysis of air in a living space in the winter period by means of Krok apparatus. Again, Krok apparatus is used to measure what? Air microbes. We view the total number of microorganisms in 1 meter cube of air. And the answer was what? 7,200. What is the allowed number of microorganisms for air to be characterized as a pure one? In other words, at what value can we say that this air is pure or it is not contaminated or it is good? it is good. At what point? I discussed this with us the last time, that this is just something you must know. They are like values you must know. Now, for clean air, in winter, we must have less than 4,500. In winter, have less than 4,500. In summer, less than 1,500. If I were you, I'll be writing it down. In winter, to classify something as pure, it must be less than 4,500 in winter. Now, in summer, it must be less than 1,500. 1,500. Now, to be classified as impure, in winter, supposed to be more than 7,000. And then in summer, supposed to be more than 2,500. 2,500. Again, clean air in winter, 4,500. And then in summer, less than 1,500. To be classified as impure, it's supposed to be at 7,000, more than 7,000 in winter, and more than 2,500 in summer. So over here, to be classified as pure, and in winter, we are looking at somewhere around less than 4,500. Less than 4,000 or up to 4,500. 4,500. All right. We have a maximum permissible concentration of carbon dioxide in the air. Maximum permissible concentration. That means the allowable concentration of carbon dioxide in the air. Question is, what is that acceptable permissible maximum? Or what is the allowed concentration of carbon dioxide in the air? That's what this question seeks to ask us. That's what this question seeks to ask us. So usually, the normal levels of carbon dioxide in air is 0.07 to 0.1%. 0.07 to 0.1%. And this is true for the ward and for the classrooms. The ward and the classrooms. The ward and the classrooms. Okay. That's what is there. So again, we are talking about what? The purity in the classroom. So definitely, I said, supposed to be between what? 0.07 to 0.1%. So for the maximum, it should be what? 0.1%. For the minimum, is 0.07. So if they had asked us for minimum, we could have gone in for what? 0.05, since it is the closest to 0.07. But since they are asking of maximum, and our answer is there, we can easily go in for what? 0.1%. 0.1%. So your answer is D. The answer is D. So you can find more of these on our Medent website, medentweb.com. I will put a link in the description so that at the end, you can just check it out to solve more questions and practice more. So let's continue. When examining the parameters of Deck's natural lighting in a school class, it was determined that the light angle is 25 degrees, window angle is 3 degrees, window angle is 3 degrees. Window to floor area is 1:4. Daylight factor is 0.5%. Window head to room depth ratio is 2. What parameter does not correspond to the hygienic norms? What does not correspond to the hygienic norms? And over here, we could be looking at the case of what? A daylight factor. Why? Because a daylight factor is the ratio of the light level inside the structure of a light level outside the structure. I don't know, I'm confusing you. But basically, the minimum daylight factor or the minimum value should be at least 2%. The minimum daylight factor should be at least 2%. At least 2%. And that's for the classroom. So now in the living rooms, the maximum should be at least 1.5%. I repeat, The minimum daylight should at least be what? 2% in the classrooms or the schools. Then in the living rooms or the dining rooms or the study rooms, the minimum should be what? At least 1.5%. 1.5. So if you look at the condition over here, we're having a daylight factor of 0.5. 0.5%. And again, this classroom, so at least it's supposed to be what? 2%. The minimum should be what? 2%. Minimum should be 2%. So that means it is 2 or more. 2 or more. And this is very less. So your answer here should be what? Daylight factor. All right. So D. A 29-year-old patient works as a motor mechanic. Anamnesis shows a frequent exposure to cold. Frequent exposure to cold. Exacerbation of chronic bronchitis. That means lung inflammation. The bronchos. And it is accompanied with what? Cough with relatively small amount of mucopurulent sputum. Subfebrile temperature. Sometimes joined by hemoptysis, that is blood when coughing. And then pain in the right side of the chest. So whatever that's happening, it's occurring on the right side of the chest. Now the breathing is vesicular, which is the normal breathing for every human being. X-ray shows darkening. Guys, look at the X-ray. There is what? Darkening and sharp decrease in the size of the lower lobe, distinctively visible on the X-ray image as a streak of 2 to 3 centimeters wide, situated at the angle from the root to the frontal costodiaphragmatic recess. Costodiaphragmatic recess. So the most likely diagnosis should be what? The most likely diagnosis should be what? Again, I think I've made mention of some of these things a whole lot of times, but depending on based on the presenting symptoms, we can think of 3 differentials. 3 differentials are possible, and these are what? The peripheral lung cancer, a tuberculoma, and a pneumonia. Okay, hemoptysis, all of these presenting symptoms. You are thinking of pneumonia, tuberculoma, or peripheral lung cancer. Peripheral lung cancer. Now, they are saying on the X-ray, they can see some streaks. These are like notes, okay, or shades. Let me put it that way. They are notes or shades or shadows, if I should put it that way, that can be found on the root or the lung root. Can be found on the lung root. And that's what over here, the more appropriate answer will be a peripheral lung cancer. Because when there's a cancer, you can see these kind of nodes occurring at the root of the lungs. The roots of the lungs. So therefore, here we are looking at the problem with what? A peripheral lung cancer. And don't forget, there is what? A subfebrile temperature. Subfebrile. Now, in pneumonia, there could be what? An increase in temperature because it's an infection. So there could be an increase in temperature. But over here, they said it's subfebrile. Subfebrile. So your best bet would be what? Would be the peripheral lung cancer. A 52-year-old patient who has been suffering from angina pectoris for 2 weeks has more and more frequent pain attacks in the right area behind her sternum, and his need for nitroglycerin increase. You know, nitroglycerin helps the heart a lot. People suffering from what? Angina, to be specific. Now, objectively, the condition is moderate. Skin is pale, heart sounds are weakened, rhythmic, heart rate is 84. ECG, guys, look at it. Look at this. Very interesting. The EEG shows no signs of focal myocardial damage. That means there's no sign of what? Myocardial infarction. There is no sign of myocardial infarction. That means you can't be talking about perhaps a stable, or you can't be talking about, you can come talking about a stable angina or acute cardiac infarction or whatever it is. However, this is just a matter of time. Angina or myocardial infarction will be evident. Just a matter of time. Just a matter of time. And that's why we can confidently say we are having a progressive angina pectoris. Now, angina pectoris simply means heart pain or chest pain. And mostly it is caused by what? Myocardial infarction. But ECG is showing that there's no sign of myocardial infarction. That should tell you that we are having a progressive one. So it's just a matter of time.
How are you doing?
Shown. Uche, mute your microphone. Aha. So we have what? A progressive angina pectoris. Progressive angina pectoris. So here, your answer should be what? Should be E. Progressive angina. Progressive angina. An 8-year-old boy during preventive examination was determined to have changes in his spine curvature in the frontal plane. The right shoulder is lowered and flat. Scapular angles are of different height due to the right scapula being shifted down, being shifted down, being shifted down. Waist triangles are pronounced on both sides. Longitudinal muscles of the back form the muscle cushion on the left. What type of posture is detected in this chart? If you are familiar with kyphosis and scoliosis, then this should be an easy case for you. So over here, we're having a case of what? Scoliosis. Scoliosis. And scoliosis is simply a sideway curvature of the spine that occurs most often during the growth or before puberty. Before puberty. That is what? Scoliosis. Now, in kyphosis or chaotic or in kyphosis, it is when there's an exaggerated curvature of the upper spine. The upper spine that eventually creates a hunchback appearance. So people with hunchback appearances, we call them what? The kyphosis. They are current tense, so kyphosis. But this is a case of what? Scoliosis. Now, lordosis would be what? The lower part. Lordosis will be an inward curvature of the lumbar part. Inward curvature of the lumbar part. So please take note of the different cases. So here we're having what? Scoliosis or scoliotic. A patient with cardiac infarction, that's MI, is on a sick leave for his medical certificate being continuously extended for 4 months, according to the standard procedure. Now, again, this eventually will tell you that who is responsible for that or who can give a leave for more than a month. And you know them already. That is what? The MSEC, that is the Medical Social Expert Committee. Now look at the question. They said the disease is still progressing. The issue is put forward to refer to the patient to the individual injury assessment board. Who among the medical staff of the medical and preventive treatment is authorized to do this? To do what? To give a sick leave. And your answer is what? The Medical Social Expert Committee. Perhaps the same as what? Medical expert committees. So your answer should be what? Should be E. All right. A 9-year-old boy has been suffering from bronchoectasis since he was 3. Bronchoectasis. That is perhaps dilatation of the mucus. Exacerbation occurs 3 to 4 times in a year. So this could be which health group, maybe health 3 or health 4. Health group 3 or health group 4. We talk about it. Now, conservative treatment results in short periods of remission. The disease is progressing. Child is physical retarding. Child skin is pale. Acrocyanosis. Sorry. He has a watch glass nail deformation. Nail deformation. Again, this is that we are having what? Hypoxia. So finger clubbing, watch glass, whatever, they all mean there is a case of what? Hypoxia. Why? Due to therefore the air will accumulate but air cannot go out. So hyperventilation. Hyperventilation is occurred because of what? Bronchoectasis. That is what? A permanent dilatation of the bronchioles. Now, bronchography revealed a circular bronchoectasis of the lower lobe. Again, it confirms it. So what is your further treatment tactics? Ladies and gentlemen, you have to do what? A surgical treatment. You don't have to do a conservative treatment because you have already gone through the conservative treatment for far enough. Now, because they said conservative treatment results in remission. So you have done conservative treatment. So there's no need for any other what? Conservative what? Treatment, but rather do a surgical what? Treatment. Do a surgical treatment. So your answer is surgical treatment. That is what? C. A 29-year-old female patient, complaints of dyspnea. Heaviness, and chest pain on the right. Body temperature rise up to 37 degrees. The disease is associated with chest trauma, which was received 4 days ago. Objectively, the skin is pale and moist. Heart rate is 90. Regular palpation revealed dull sound. Auscultation revealed significantly weakened vesicular breathing. Blood is 2.8. Color index is normal. Hemoglobin is quite low. What result of diagnostic puncture of the pleural cavity can be expected? Now, you must look at the question critically because this person has had a case of what? Chest trauma. A case of what? Chest trauma. And when you have a chest trauma, what can result? There can be what? Hemothorax or hemothorax or pneumothorax. Hemothorax means blood accumulation in the pleural cavity or air or fluid accumulation in the pleural cavity. So over here, we are definitely looking at what? A hemorrhagic, because it is not air, obviously, but of course, we can think of what? Blood. So here, we are looking at hemorrhagic punctate. Hemorrhagic. So here, your answer is supposed to be what? Should be C, hemorrhagic. And again, the palpation also goes on to clarify what we are definitely talking about. Auscultation, there's weakness over there. No. The answer is C. A 54-year-old man had been drowning, when he was found and evacuated to the shore. He's unconscious, face is pale, no breathing, can be auscultated. There's a steady pulse. Now, we say under what condition do we say a person is dead? When there's no breathing and no what? No breathing and no what? Circulation. No breathing and no circulation. But over here, there's what? There's a thready pause. So though there's a pause, but it is what? Kind of thready, or it is very weak. Very weak. Now, as resuscitation measures allowed to save the man, what complication can develop in him in the nearest future? Guys, you have drowned. You have drowned. So if you drown, don't forget you're going to swallow a lot of water. Okay, or a lot of water can get into you. And some of these water can enter into what? Into the, how do you call it? The lungs. Into the lungs. And that is very, 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 very crucial. That is very, very crucial. That's when somebody is drawn like that, and you bring the person onshore, you start doing CPR, isn't it? And the person will cough some water out. Those water were found where? Exactly. Maybe in the lungs. So it is coughing it out so that the lungs can be free to now what? Breathe in. Breathe in. So we're having a case of what? Pulmonary edema. Pulmonary edema. So your answer here should be B. Pulmonary edema. All right. A 7-year-old child complains of cramping pain during occurring after mental exertion, cold drinks, and eating of ice cream. Instrumental examination allowed us to diagnose him with what? Biliary dyskinesia. Again, we all know that the biliary tract is involved in what? In contraction to release what? Bowel. But here there's dyskinesia. That means irregular what? Movement. Okay, there's irregular movement. And it is of hypertensive type. Now, what group of drugs should be prescribed for the treatment? Now, you're having a case whereby there's no contraction, and so therefore there's no movement of what? Of bowel. There's no movement of bowel. So what are you going to do? What we are going to give here is antispasmodics. That means antispasm. Prevent spasm. Prevent spasm. And allow for what? Cholerectics. Allow for what? Cholerectics. Cholerectics. So these go a long way to help. But of course, the effective treatment is to definitely remove the gallbladder. That will be what? The effective treatment. The effective treatment. But for management, we can definitely use what? Spasmodics. Spasmodics. So your answer should be D. So should be D. All right. Caries. You know what caries is? Tooth infection. Morbidity rate is 89% among the residents of a community. It is determined that fluorine content in the water is 0.1. What preventive measure should be taken? What preventive measures should be taken? Don't forget, anytime we have caries, we're talking about dental decay or a tooth decay. And tooth can decay, or one of the reasons why tooth would decay is when there is inadequate supply of what? Of fluorine. Inadequate supply of fluorine. That's why you always brush your teeth. Now, brushing your teeth does not only remove dirt, but it also nourishes your teeth. Don't forget, every paste has some level of what? Fluorine inside. Please just take note. Every single paste that you use has some level of fluorine inside. So over here, what are you going to do? With respect to the drinking water. So over here, we'll do what? Water fluorination. We'll do water fluorination. Water fluorination. And in that way, it's going to prevent what we are having. So over here, your answer should be water fluorination. Fluorination. All right.